About 500,000 people in the UK have an inflammatory bowel disease of one kind or another. They're really debilitating conditions. My family will attest to our many, many visits to hospitals over the years.
So there's a variety of different treatments, and they span from dietary interventions in some instances, through relatively simple anti-inflammatory medications, through steroid treatment, immunosuppressant treatment, and injectable biological therapies, as we call them. These are antibody-based treatments.
So you get put on a biologic and they don't always work for everyone. And then you do get on one, you think, and then they stop working and we don't know why. And that's one of the reasons for doing this research, for bringing the data together.
Looking at the wider health sector, most of them have not yet reached a position where they're ready to share data. The impact of the whole gut reaction programme, of which Privitar is part, is that data is being made available to industry and to academia in a much broader sense than it was before.
Gut reaction essentially was a mechanism by which we could access routinely collected healthcare data, where it could be lined up with a wealth of other information.
I was approached to have a look at this sort of new idea of a project, that it sounded really exciting, but patients need to be involved in understanding how their data is going to be used.
Privacy is a risk assessment. If the data is held in a TRE, you can be slightly more relaxed. If it's going to be downloaded and used, you're a bit more firm.
If I wasn't sure that there were sort of privacy measures in place, I wouldn't have given my data for this.
When we're looking at de-identification, the two solutions are we do something proper, like Privitar, or we try and do it ourselves. Could we do it ourselves? And the answer was not easily, not readily, not repeatably. Privitar is valuable enough to us that we've now taken it on for the whole of the bioresource, which includes another 7 different disease programs.
Once people are diagnosed with these conditions, being able to get a much more granular view as to what the future holds for them, and therefore what treatments we should put in place, what's going to be the best treatment to use in a given person at a particular time.
You can see the potential of what you can do if you start bringing together people's prescribing data, their scans, their genetic data, their hospital records, an amazing picture of the life cycle of somebody's illness. But you need to make sure that it is safe and secure, that data's de-identified where it needs to be. And then I think patients and the public will be more confident and trustworthy and more comfortable to give their data. So we can find out all these amazing discoveries that I'm sure are out there.
Maintaining privacy in an ever more complex world and still allowing people to get at the data is an absolute challenge, which is where we as a group have said, you know what, we cannot do this ourselves. It is foolish to pretend. We will always try and use a service, and Privitar is a fantastic software platform for us to do de-identification.
I think the future's really bright for gut reaction and other health data research hubs. It's been a brilliant model we put together that you can sort of roll out for other conditions beyond IBD.
Data is powerful, as we all recognise. It does have some limits. There are some cautions that need to be applied, but certainly as people gain confidence in the use of their data in research, the outputs will begin to come through and make it very clear to people that the benefits of participating in these sorts of things.